A phased array transducer with an abdomen exam type is used to perform the right upper quadrant view of the FAST exam. The orientation marker is directed toward the patient's head. The transducer is placed in a long axis orientation along the right mid-axillary line between the 7th to 9th intercostal space. Rotation and oblique positioning of the transducer will help eliminate rib shadows. To evaluate the entire area of the hepatorenal recess for free fluid, sweep the transducer from an anterior to posterior position. If present, fluid will appear as a dark or anechoic stripe between the kidney and the liver. If it is difficult to visualize the hepatorenal recess, a deep inspiration will move the diaphragm and other structures in this area down and below the ribs for easier access. Sliding the transducer upward will visualize the diaphragm and pleural interface. Sliding the transducer downward will visualize the inferior pole of the right kidney. A phased array transducer with an abdomen exam type is used to perform the subxiphoid or subcostal view of the heart in the FAST exam. Place the transducer in the subxiphoid position with the orientation marker to the patient's right side at a 9 o'clock position. This view uses the liver as an acoustic window to visualize the 4 chambers of the heart. Aim the transducer slightly toward the left shoulder at a 15-degree angle to the chest wall. In some cases, the transducer is almost flat to the abdominal wall, so the ultrasound beam is directed toward the left chest cavity. A considerable amount of ultrasound gel and downward pressure may be needed to maintain contact of the transducer face with the abdominal wall. Increase scanning depth to visualize all chambers of the heart. The first structure seen closest to the transducer is the liver. The right side of the heart will appear closer to the transducer than the left side of the heart on the ultrasound image. The myocardium will appear gray, and the blood-filled chambers will appear hypoechoic. The bright white pericardium is seen surrounding the heart adjacent to the gray myocardium. Evaluate the function of all chambers. Compare the size of the right and left ventricular cavities. Note any wall motion abnormality and the presence or absence of pericardial effusion. A phased array transducer with an abdomen exam type is used to perform the left upper quadrant view of the FAST exam. The orientation marker is directed toward the patient's head. The transducer is placed in a long axis orientation along the left posterior axillary line between the 5th to 7th intercostal spaces. The sonographer's hand will touch the gurney with the proper transducer position. Rotation and oblique positioning of the transducer will help eliminate rib shadows. To evaluate the entire area of the splenorenal recess for free fluid, sweep the transducer from an anterior to posterior position. Carefully examine the splenorenal recess and subphrenic space. Fluid will appear dark or anechoic. If it is difficult to visualize the splenorenal recess, a deep inspiration will move the diaphragm and other structures in this area down and below the ribs for easier access. Sliding the transducer in an upward direction will visualize the diaphragm and pleural interface. A phased array transducer with an abdomen exam type is used to perform the pelvis view of the FAST exam. Place the transducer in a transverse position with the orientation marker to the right at the level of the symphysis pubis. The pelvis is evaluated in 2 planes. It is easier to perform this exam when the bladder is filled. The bladder is used as an acoustic window to view the cul-de-sac or retrovesicular space for free fluid. To visualize the bladder, angle the transducer inferiorly into the pelvis. If it is difficult to visualize the bladder, slide to the left or right of the symphysis pubis to bring the bladder into view. To evaluate the pelvis for free fluid, sweep the transducer from an inferior to superior position. Fluid will appear hypoechoic or anechoic and accumulate posterior to the bladder, posterior to the uterus, and between loops of bowel. To obtain a long axis view, rotate the transducer 90 degrees with the orientation marker pointed toward the patient's head. Sweep the transducer across the pelvis from left to right to evaluate the pelvis for free fluid. A linear array transducer is used to evaluate lung sliding as an extension of the FAST exam. The orientation marker is positioned in the direction of the patient's head. The transducer is placed in a long axis orientation over the anterior chest wall at the third or fourth intercostal space in the anterior axillary to mid-clavicular line. The ribs are identified in the near field of the image as a bright interface with a posterior shadow. The pleural line is identified as a bright hyperechoic line between the rib shadows. The to and fro sliding movement of the visceral pleural against the parietal pleural with breathing generates the lung sliding sign.